Yes. Okay. All right, Seth, it's over to you.
Yes, good afternoon, everybody. I just want to give a quick introduction to Bryan. I've got a few notes here. So Bryan is a leader in the emergency management and healthcare preparedness. So he currently serves as a health program manager for the Utah Department of Health and Human Services and is a member of the Utah Health Emergency Response Team. So Bryan has an extensive background, which includes roles as civilian contractor for the Federal Air Marshal Service and Director of Material Management for St. Mark's Hospital Hazmat and Disaster Response Team. He has also managed emergency services for Stored Healthcare in Utah and held leadership positions with the Utah Hospital Association. And during the COVID-19 pandemic, he was the Unified Command Logistics Officer, overseeing logistics for a mass care center and managing the distribution of over 207 million PPE and testing items. So we are lucky to have Bryan talk to us today. And I encourage you to ask questions, get curious, and just have a good time. And with that, I'll turn it over to Bryan.
Okay, thanks, Seth. Hey, can everyone see my screen?
Not yet.
Not
No.
yet. How about
There
now?
you go. Yep.
Okay. So everyone, all my old friends there, and then my future friends yet to be. So I'm with the Utah Department of Health and Human Services. Let me do a little introduction so you guys know who we are. Okay. Come on, there we go. Okay, so I'm with the Office of Preparedness and Response, formerly the Office of Emergency Preparedness and Response, but we've made some changes. Part of the Utah Department of Health State ESF, that's an emergency support function, number 8. So when things get bad, okay, I will share this information for you later on, but this is my immediate knowledge here. Okay, and what we're doing today, we're developing good relationships before the bad things happen. During COVID, we had a lot of really challenging times, and because of the relationships that we had before, we were able to make it much better. So it's really important you guys get to know who I am, and I get to know who you are before something really bad happens. When you're requesting a scarce resource, remember everything happens locally. It all happens at a local level. And then you guys something happens, you would ask for assistance from the city, the county, or your local coalitions. Do you guys know the contact information for those people? And if they're not able to help you, they come to the state, up to my level. If I'm not able to get you what you need, we go to the federal level. Now, a lot of people say, well, I'll just go to the feds first and get it from there. Unfortunately, they'll just kick it back down to us and say, hey, did you know about this? Do you want to take care of this? And we'll move on from there. But everything happens at a local level first, and you just take the progress up, hopefully quicker, sooner than better, to get you what you need. But every agency has to exhaust all the resources. This is not a blue skies day. This is an emergency, and it has to be a declared emergency to request these supplies. We do this almost yearly, especially with the EMAX, which is the Emergency Management Assistant Compact with other states. We do this with personnel for wildland fires. We do this with personnel for hurricanes. We send a disaster response medical team down to Florida, Puerto Rico. We've gone all over the place. So there's a lot going on, and our main concern, though, is local here first and how we respond. A resource agreement, this is what it sort of looks like. And the main things you have is the CSALT, which is the capabilities. What are your expectations? Don't just tell us you need a ventilator. What do you want this ventilator to be able to do? Size and description, okay? Amount, how many do you need? Quantities, where do you want it to go? If it has to be brand specific, because you might have all the support supplies, tubes and accessories that only go to one brand and not another. So we need to know that. and a time period of when do you need it and how long do you need it. So these important information that we need from you. Okay. So part of the state, we have these, what's called an MRP, mission ready packages. You can request. This includes medical staff, medical supplies, medical equipment, medical sheltering, mobile trailers, and other types of support. Let me be clear on that medical staff. We have medical staff that's can respond in a 12-unit team or up to 75 people. So we can scale it depending upon the emergency. But these are staff from your own facilities that have volunteered to be with the state and get paid with the state to be able to respond in case of emergencies. So these aren't outside the state people coming in. That's a different program. These aren't people that are just sitting around. These are actually people in jobs working day to day and that will respond in case of an emergency. EMT, paramedics, doctors and nurses, okay, throughout the group. And we usually every year we do training with them. New team members come through a resource of training recommendations, and they come through and they have this training so they can go respond. Every year we go down to St. George into Ironman, so we get hands-on training. Every so many years we might get deployed out of state, depending upon the catastrophe emergency that's going on, and be able to respond there as well. Okay, we have medical supplies. Now, most of these medical supplies are nowhere near what you guys were probably used to. This was a state program for an emergency and for first responders. So we're trying to be a supplement for the first responders. That includes burn care, pediatric care, OBGYN, PPE at different levels. Okay, a pharmacy cache of a limited amount of a specific meds, okay, and responder first aid kits. We have field medical equipment. This is portable medical equipment we can take out on the field. This is not big, giant ventilators, life support systems that can be moved. This is something that's easily picked up and moved quickly. So we have blood warmers, mobile labs, high flow nasal cannulas, all sorts of different equipment that we have available in case of an emergency. We have shelter systems, smaller iPods that can be about 20 patients, and or isolation units that can move more patients through. This is just field medicine to establish control and then move off to a more permanent state. We do have a Utah medical station that was a former federal medical station, and that's the inner structures of a 250-bed hospital. That's not the structure. That's just all the internal stuff, all the beds, IV poles, all the inner workings of a hospital that they're in medical units, a tri-walls we call them, and that can be moved to wherever you need to set one up. Different areas can be moved very quickly. Okay, mobile trailers. We position these trailers throughout the state, have them pre-positioned, and we rotate them. Either it's a Blue Med hospital that some of your facilities might be familiar with, mass casualty trailers, mass fatality trailers, morgue trailers, environmental control units, and even decon shower that we can move to different parts of the state quickly and have available. Okay. Other support functions for emergencies, we have communications, we have radio systems, we have a BioSeal, which is a mass fatality system, generators of different sizes, different power units, mobile transportation. We also helped last year's flood situations and continue into this year's flood situations with sandbags and work with the opioid outreach with the Narcans. If anyone has any questions, please feel free to ask a question, raise your hand. I'm open to any questions. You don't have to wait to the end, please. Okay. So back in October 9th of 2019, I did a presentation for this group. Went down there and did it in person and talked about, hey, this is what the state's looking at. This is our initiative that they want to start to push out. The government's willing to push this out. So we talked about the growing dependence upon imported manufacturing. Remember when this was October 2019? Okay, we talked about the growth and development and the warning signs we saw, the over reliance on just-in-time inventory. Okay, and how when something happens, when something bad happens, it's going to be a higher cost with less availability, higher risk with less quality. Okay, lost revenue and lower satisfaction. Unfortunately, right after I give this presentation, we had the COVID-19. This is me down at the South Jordan Airport with the first patient that we flew in from the cruise ships. We're having to go down there and meet that patient, being able to give them the proper medical care that they needed. And this turned everything around. This is a really bad situation, but it could have been much worse. So we learned a lot from here. And public health sort of wants to understand supply chain better. So please help me with this. They have questions and they're coming to me saying, hey, teach us about supply chain. Why did this happen? What happened here? Why do they keep having these shortage issues? They don't understand. You guys live this. Okay. You live it every day. You understand these things, but they don't. Why don't you stockpile more inventory? And I have to explain that to them. Okay. It's not the same. It's not the world in which they think, in which they're dealing with, they're used to. They don't understand these questions. Why are they so brand selective? Okay, why won't you guys take a glove that they find they're able to get quantity on hand, but you guys say, no, I don't want that glove. There's a reason for it. They don't understand that. So I had to help them answer these questions. Okay.
Hey,
Right.
So what
Brian,
question?
you have a
Yes.
couple hands up.
Oh, okay. Seth?
Yeah, just kind of going back to that timeline, it looked like there were some big spikes in a couple of the months. Did you see with, I guess, like the supply chain and emergency preparedness, that those months like struggled particularly, or was it kind of consistent throughout like those lower periods as well, like March through November?
Yeah, so those were the Omicron and the different things of when they spiked, we did see, but it wasn't necessarily from supply chain or the hospital perspective. This is from the community. So we're used to, requests from hospitals and distribution centers, things like that for healthcare workers. Remember during COVID, this was for everyone across the state, from K-12 school children to first responders, police, EMS. This was everyone. So it was interesting to actually graph the difference between your requests that were coming in and the uptakes of when we're actually getting more cases, because you really saw a different spike system here where most people were, trying to, hey, I don't have anything. I need everything right now early on. And then it sort of went down and then, oh, well, we're good now. We don't need any more. Then it peaked back up. And you'd see now they went through what they had, try to go through their burn rates, and then they would request again at different time periods. So it wasn't quite what you saw on this graph. Does that help answer that?
Yes, thank you.
Okay. Danielle.
Brian, I just had a question about the communication, especially, where you showed the different levels starting locally and then moving up through state to federal. How often is communication happening? And then does that change? Does that cadence change, or does that look different depending on, the emergency or the status of the situation? I'm just kind of curious how that whole communication works.
Yeah, so you guys should, great question. Yeah, you should have familiarity with your local EM and your facilities. Your local EM would be that liaison for you to reach out to the city, the county, or the coalitions, and they would be familiar with them of how to get the resources you might be looking for. And if they can't, then they come up to the state level. Now, I know some of you personally, and so sometimes you guys call me directly, and I just said, remind you, have you talked to the city yet? Have you talked to the county yet? So there's many different ways this goes about, but formally, when there's a declared emergency, there's a set path that these are the rules. This is who you should contact. A lot of organizations, they're not just local. A lot of you guys are national level. So you can go outside that level. You don't have to go through the state. If you guys keep it internal and want to go through your own organization, you're welcome to do so.
Thanks. And so between agencies at like city, state, federal, there's not like a set communication path. It's more from like the provider or supplier that needs, right, and communicating to those different agencies then. Is that right? And
Well, it
based on
depends
their
upon
need.
it depends
Yeah.
upon the situation and at your need, just like you said. Each
Okay.
situation is different, but that's going to be one of our key findings here is how do we communicate and how do you want us to communicate to you so you can make sure you have that information that's coming to you.
Hmm.
I mean, I was able to work with a group that I knew during right before COVID and being able to get the information we needed, but things have changed. A lot of staff turnovers changed. So I want to make sure everyone's on that same page with communication.
Yeah. Great. Thank you.
Any other questions? No? Okay. Again, so did supply chain learn anything from COVID? Okay, the first question they have is exploring broader contract options with multiple sourcing. Have you guys moved away? Has everyone moved away from sole source agreements? I'm not seeing your head shake if you are, because most of you turn your cameras off.
I think it depends on the product category. In some product categories we have. In others, we've either mitigated that by trying to bring in additional inventory or developed a strategy with the supplier for them to warehouse additional inventory near and around Utah.
Okay, good. Do you know where your products come from?
Unfortunately, yes.
and you know the hazards in those areas, right?
Yes, unfortunately, we know where that all of our 89% of the world's spun-bound polyurethane stuff that we use for masks and our isolation gowns is made out of Wuhan, China, which is where it all started, and it still is. And yeah, what can we do to mitigate that, right? It's really a challenge, but I think it's gotten better since the pandemic because we've signed up to get all of these notifications of any type of natural disaster or political unrest or any of those throughout the world so we can know what suppliers are being impacted by that. And we probably didn't learn well enough from Hurricane Maria, but I think the pandemic really taught us to understand more of where your stuff's coming from, not just the finished product, but where the raw materials that go into it.
Exactly. And that brings us right into the next question. So connections to the new technology and information systems. You were just saying that now we're getting updates from globally that, hey, if something happens here, we're gonna see that downstream. This is gonna come our way. So are we prepared? Now, the question is, how soon are you getting those information? Because Puerto Rico has that IV solution. Do you have that backup system in hand, or do you have an alternative vendor in mind if something really bad occurs there? Are you able to survive that? And I know you guys are doing a lecture soon on AI, right? And its effect on supply chain. So that's going to be fantastic. So I think you're learning some lessons here. I think you guys have, your eyes have been opened and you're going to let things go a little smarter this time. Questions?
How do you account for some of the rural areas that oftentimes, big suppliers like HCA, Intermountain, the university, we have a little more things at our disposal, but how do you meet the challenges of a lot of the rural hospitals or independent facilities?
So our main thing is to get a relationship with them. We have to be able to understand their needs and where they're at, because we're so familiar with the big four here locally, but the Rule 9, that's a little harder for us because we don't have that day-to-day interaction. We don't have those relationships. And so it's really getting to know them better and them getting to know us of what our capabilities are. So It's just important of establishing those in the good days so you can do something more for them. Scott, go ahead.
So unfortunately, I'm in a room with a lot of materials people, so I'll speak openly and honestly about this. So we as an organization, we're able to get lots of supplies in, different types of gloves, masks, etc. We would try to distribute those out through our staff and to our units. And a lot of time we were met with resistance on that. These are gloves or masks or different things that we're not familiar with. No, we're not going to use them, and things like that. And I think that was one of the big lessons I learned is really how much power nursing staff obviously has at different facilities. What steps can we take, or what things can we do to help mitigate that for any future occurrences? Have you done anything to kind of analyze product that's happening more at a local level on your side?
Well, at local level is interesting because we don't get a lot of product from the local level. It's all coming from international level. So it's coming from abroad. So our main understanding is trying to educate people of why they're maybe not trusting a certain product. I mean, during COVID, we had a lot of product that was very questionable and very unacceptable in my standards. I had to turn a lot away, but the purchasing people trying to do it, they don't understand the difference. To them, a Tyvek is a Tyvek. They don't understand the difference between them. They don't understand different levels. So having that education of this is what our requirements are and this is our expectation of it, it's important on this end. But then it's also important, like you said, to teach the nursing staff that, hey, during this time, this is the best we can do and still provide this level of protection for you. Though it might not look the same, it might not be the same thing you're used to, but this is only temporary until we can get through this procedure, until we can get through this time. Other stuff might be on its way, but this is the stopgap measure we have right here, right now. So it's a lot of education and on both sides, really on both sides. Thank you.
Thanks, Brian.
Samantha.
Just adding on to Scott, because I am in purchasing, so I am on the other side. I know that since COVID, we have started quite a few new processes that we have been implementing and changing around a little bit, trying to get that clinical point of view, because obviously purchasing, we are looking at the contracting side, the pricing side, descriptions and whatnot. Like you said, we're not hands-on, we're not clinical. So we don't know anything other than what we just can pull up on a computer. We don't know what the value behind it. And so we do have our value analysis team that does have that clinical side that is also assisting with the contracts and everything, at least with the U, that has, I think, helped quite a bit. And again, we're still improving those processes, but if everyone has learned from COVID like we have, we definitely realize that there need to be a lot more communication going across the board, because you'll end up butting heads, like Scott mentioned, between the clinical staff, material staff, purchasing and whatnot, if we don't have that clear communication between each other and processes in place. So
agreed. Thank you. Okay. Let's talk about developing supply chain resilience. How have you grown stronger since COVID? Okay, you guys have told me stories already. Better communication. Okay, what else?
One thing for like the university too is they've kind of put standards in when ordering merchandise to where there's multiple people who have to pass it off versus just the main source of ordering, and then it just gets delivered. It kind of has to be checked through everyone for that quality for our patients, to make sure we're not just kind of ordering obscured products that aren't going to work for our end users. So there's like multi-point checks between all levels, if that makes sense.
Is that making it harder for you?
Yes and no, depends on when you ask me on a certain day, but but I mean, there's a reason for it. And what would happen before is people would order things and it's not the right thing or the wrong material, or they didn't read the description. So it's kind of made it better because there's less turnover as far as returning product. and just making sure all of us have the proper communication to have the right supplies that is needed for what they're requesting.
So true. Thank you. Another question?
Oh, I was just going to mention on your resilience. I think what we learned the most was to break down some of the silos. So I am clinical, but I also am in the value analysis team. And I will be very honest, I didn't care where a product came, get me my product. And there's also a difference between what I will accept in an emergency situation versus what I will accept day to day. So having those conversations and bridging those gaps and those silos, even to the point of we gave masks out to front staff PSA who had never had a mask put on in their life, but yet we didn't teach them how to put it on. So as the educator, I was having to go out and saying, hey, you can't handle it this way, you can't do it this way, or you're putting yourself at risk. So making sure we're addressing all of those silos and all those things.
Yeah, education and fit testing is horrible to do during an emergency. That's the worst time to do it. And unfortunately, when things change because a product changes, that is difficult. That is very difficult. Any other questions? Okay. So you talked about this, breaking down silos and everything. When's the last time you coordinated with somebody outside of your organization? When have you kicked down that door, that wall? I mean, you guys are meeting all together. That's a great, great start. And hopefully you have those communications with each other about shared opportunities you have, shared lessons you had. That's what this is all about. Okay. So how about predictive risk analysis? Are you guys really looking into what the market risk is for your product? We cannot avoid it. We live in this market where we have to bring in things from overseas. But are we rating that as a risk? Do we put that down and say, okay, this is a high risk, this is a low risk? I understand that I bring this in, makes a lot of people happy, it meets the needs, but it's a high risk item that we might not have this tomorrow if something happens. Have you guys gone through that? Has your management gone through that? As part of that purchasing process of what the risk is for it? Okay, something to think about. Okay, developing partnerships. How transparent are your manufacturers and distributors? And what's the current level of trust with them? Hopefully everyone's gotten better after COVID and things have gotten better and you can trust no more allocations, right? Hesitation. Maybe not so good yet. Okay. But in time, okay, give it time. Okay, hopefully things do get better and hopefully your manufacturers and distribution centers are being more transparent and are letting you know about things coming up before they happen, before you're caught behind that 8-ball. Okay, they owe it to you. And if they're not, maybe hold them to it. Say, hey, I want to know about this. I want you to communicate with me. I'm not just giving you money. I want some communication here. Okay, part of the contract. Okay, next steps. So the state wants us to do a supply chain integrity assessment. They want this to be a yearly assessment for the next 5 years and said, hey, Bryan, get to that. It's like, okay, what is it you're going to need? So this is what they tell me they're going to need. I need to know what your resource needs are. Describe the equipment and supplies that are most likely to experience high demands during emergencies. I've come up with a list of 142 critical medical devices. And I can share that list with you guys and see if you agree or disagree. But think about that. What equipment are you most likely going to have issues with? Equipment and supplies. When I'm talking about this, is it based upon your average patient census? Based upon your burn rates? Where are you currently? Are you at a 2-day supply, but after 2 days, you're going to struggle? 30-day, 90-day? That just-in-time inventory, 2 days and you have to get restocked. But hopefully you think about this and let me know what your resource needs are. Vulnerabilities. What are your current vulnerabilities in supplies? Is it the blood supply, oxygen? And for pharmaceuticals, I really need to know a point of contact for each of your facilities because the state wants to do an antidote response network, working with poison control, and they need to reach out to your pharmacist. Unfortunately, a lot of staff has changed. So if you could possibly send me the contact information for your pharmacist to help the Utah Poison Control get this information, I would really appreciate that. Okay. But then what are your vulnerabilities in medical devices, PPE? Hopefully you guys are all well stocked on that now. Okay. Disposable support supplies, all the tubing and all that things that goes onto those devices. And what other critical areas do you have? Lab, radiology, some of those areas that are really struggling right now for supplies. Okay. They want to know the current access of an infrastructure. Describe the existing access to critical supplies. Are you guys stocking anything besides what you normally burn through on a weekly basis? Your infrastructure, quality of supplies available in a regional, alternative delivery options. If for some reason the infrastructure is compromised. So is everyone working from a centralized distribution center? I know in the rural area, the standalone facilities. Some of you have regional super centers. Some of you depend upon third-party distribution areas. They're trying to get a lay of the land of what's currently in Utah. Like I said, these organizations don't know that. The government doesn't quite understand that. So they're trying to understand you better of how they can help you. Okay. Describe how inventories are managed. Is everyone going cloud-based now? Is everyone got their cyber security well in hand? That's a big thing right now. We just had a big cybersecurity conference and they're very concerned. And as supply chain gets more and more integrated with that, that's going to be a big hit coming. You guys still use the standalone scanning, the point of use areas? Are your staff manually entering the data? Okay. Different areas have different needs in there. So we're trying to understand their processes there so they can better suit you. Okay. Impacts on your community. What's your communities? Okay. The social vulnerability indicator, when we talk about Pioneer Hospital, Children's Hospital, okay, they serve that one. And luckily now we have more than one. Before we only had one that was very critical and it's on a fault line. It's not a good place to put it. So having that availability elsewhere and proximity away from it is very important. What other community disparities do you service? Okay, as an age group, Utah is a very young community. Health group, income, all these things take your toll on the supplies and its needs during a disaster. It does it every day, but during a disaster, it's even more so. So understanding your community in which you're serving, very important. Okay, mitigation strategies. What are the potential shortfalls in your mitigation strategies? Do your third-party agencies address overstock, short-dated, or supply allocation shortages? Do they share this information? If one of you is struggling in one place or one of you has overstock, do they let other customers know that, hey, there's available here? Or are they willing to act as that third-party negotiator for you? And we talked about this before. How do hospitals communicate the supply chain shortfalls through the local and state public health channels? Okay, who are you going to call when this happens? Okay, there are some things on the chat. Okay, thanks for putting those in, Mark. Okay, any other questions about this so far? Okay.
I have a quick question.
Yes.
Going back to the list, you said you had that massive list. I would imagine every department in a hospital, would have their 1 through 50, and every hospital in the state would have their 1 through 50 on their priority list. How do you, I guess, shorten that list to where it's like, hey, if stuff hits the fan, we really need these 100? Because I would imagine, there'd be thousands of items on this list. How did you get yours down?
We're looking at what's most life safety critical. What can't people do without? So it's, it would be nice to have this if we could, towards, no, this is keeping people alive. We talk about the crisis standards of care, of what it's going to mean when we don't have enough for everyone. And when the physicians have to make that hard decision of who gets the respirator and who doesn't. And how do they explain that to the families and the litigation afterwards to the law about why they didn't? Okay, it's very important that we're all on the same page there. So identifying those items, if we can get a list and see, is there any, reoccurring things here that we can maybe affect? We can't affect everything. So what can we affect? We saw very early on with COVID is the ventilators. And we were able to get ventilators out to certain facilities that needed them for quite some time. Okay, that was really important. That really helped a lot of people. But what else is out there? A lot, big lessons learned is it was all those support products that they may or may not had for that particular type of ventilator. And then what happens when there's a recall? And what happens when now the feds want their things back? So are you ready now to step back from that? And is your community ready to support it? Okay. Do you guys have any questions about public health? They're asking me questions about you. So do you have any questions about them? You know all about public health? Awesome. Goodness, it's awesome. Okay. I don't want to overstep my time. I know it's getting really close to there. Here again, here's all the links, and I'll share this out and you guys can see all these things. But for the AI and the supply chain, healthcare ready, that gives you advanced information about things that are occurring worldwide and in key areas of distribution and manufacturing even. And then that list for the 142 medical devices that can be seen at this ASPR website. And you can see where these things that their particular attention is to on right now. But again, I want to know what yours are. There's another question. Go ahead.
Hi, Brian. This is Martin from Riyadh. One of the things that I believe is that emergency preparedness starts at home.
Yes.
And is there any program or what type of education is out there to promote emergency preparedness from home?
There's the Be Ready Utah. If you look up beready.utah.gov, there's a lot of information there that has that. It talks about home preparedness and resiliency. Because you're right, if we're not ready at home, then it doesn't matter what's going to go on at work. And is your work ready to be without you? I mean, are you that key person that has that information that they're going to need? Great question.
Brian, Nikki Hamilton put in the chat, why doesn't public health visit a facility to see how supply chain functions and what their concerns might be?
That's a great question. Thanks, Nikki. We should. I don't know why they haven't, but maybe we can do a tour and invite them. I don't know if they've ever been invited before, but you'd love to go on a tour with them.
Hey, Brian, I have a question.
Yes.
This is kind of going back to our supply chain partners and our vendors. We're getting to the point where some vendors were just not telling us honest assessment of their inventory. And actually, we kind of had them either removed from the company or not to be on our account anymore. Was there any And there's to a certain point where we prefer just not to do business with them, but we had to do business with them just because of their supplies. Were there any instances where you guys ever had to face the not doing business with a particular company anymore?
Oh yeah, we had a big a run-in with one of our better suppliers. I mean, for PPE, they were great. They did an awesome job. We developed a really good relationship with them, worked with them very well. But then an issue came up with test kits, and the test kit's not so good. There was a big issue, and litigation got to where, you know, the whole relationship went south because uh, just because of a misunderstanding or maybe some education, but it was a very difficult situation. Luckily, we weren't totally dependent on them for the PPE, but unfortunately, they were one of the better ones to work with, and that relationship had to go away. It's difficult. Was there another question?
I've got
Mark,
one. You asked if we had any questions about public health, and I was just curious, what kind of questions should we be asking about public health?
Well, what are your assumptions about public health? Because, you know, at the hospital when I was there, I assumed that, you know, the state, the public health, they have plans, they have answers, then they're ready for it. I come to the state, they did not have the plans, and they were not ready for it. So there was a lot of assumptions that I had to learn the hard way of this isn't really what I thought it would be. So, you know, when you think, well, it's okay if we, you know, if something happens, the state will pick up the slack and they'll give us stuff for free. Well, that's not the way it's going to happen. And I doubt we'll ever have that time again. So, yes, Jennifer.
So if I'm coming into a situation and there isn't a plan from someone who's got to take action and do it in a way that would follow suit, where would, I mean, I assume I would start locally, right, with my manager, but then what other resources would I have that I could start utilizing to kind of back it up? Like if we have one resource for a mask, for instance, which I know is not the case, but if that were, where else would I go to find maybe a mass opportunity or assistance with transportation from the port, you know, things like that. It's like, how do I help myself a little bit when I'm trying to get a PO from one port to another, you know?
Well, first of all, for the easy questions about the mask or things, you know, you should always reach out to your local partners here. You know, your people that are in the business with you and things like that. Reach out to them first. I know if they're in the same situation as you, then you have to go to the next step. Now, if you're talking about that port authority from another state, then yeah, you need to escalate that. You need to go to there again, the city and the county, and then they say, hey, there's nothing we can do, but we can reach out to the state. And then the state has agreements with other states and said, okay, let us communicate on your behalf.
And that's kind of what I meant, was like more of a reference to if the state's supposed to be helping and stepping in and supporting us, what resources do we have, or where do we go to find out about how the state is supporting us, I guess.
There again, it all depends upon the situation, and we'd have to explore what specific is about that. There are things we cannot do about another state, but in the relationship we have with them, maybe we can find out what are our options with them. So, you know, there's only a limit to what we can do. And then if we can't, and if it's not something we can work together between state and state, then we go to federal. And we have federal partners that can also help this. Does that help? Okay, but the best thing to do is get to know your emergency manager of your facility. Make sure they understand the supply chain needs and these things we talked about, the shortcomings and everything else of what the critical things are going to be that you're going to need, about the questions you might have, and especially if you run into an opportunity, a challenge with a border like that. Okay, was there another question? Okay, here's my information. I don't want to go over time. Mark, you're good?
Yes.
Okay, I'm going to stop sharing the screen.
Perfect. Well, we want to thank